Hi, guys. Thanks for joining. This is Essence of Medicine. Today, we're going to be talking about mental health part 2. We're going to be focusing on OCD. I'm Amanda Armagost.
Dominic Moore.
And I'm Dr. Abbasi for Essence. OCD, what is it?
Obsessive compulsive disorder.
What is it?
So there's a couple of different styles of it. There's the one where it's like a pathway where you have to have a routine. Something has to be done a certain number of times before you can move on to the next one.
Like, have you seen Big Bang Theory?
I've seen an episode or two.
That Sheldon, that three times, and then calls the name. What's the name of the girl, the main girl in the
Nikki? No, it's not Nikki. Penny.
Penny.
Yes, exactly.
And I think it's not just it makes you feel uncomfortable if those things that you're supposed to do aren't done, but you actually have a feeling of dread a lot of times. Like something bad will happen.
It can be serious.
Yeah, and there's different ways of people having OCD. Growing up, I always thought OCD was like, my mom has OCD. She has to have everything exactly clean and in order. But I think that's not like the definition. That's not really true. A lot of times people with OCD will hear a fire truck and think that fire truck is going to my house.
Yeah, they told me that.
Yeah, or
this is now 20 miles away from your house. So when you hear fire truck, you think they are going to go to your house because you forgot something or what?
Every day when I leave home, I'm worried my house is going to burn down. And I usually haven't even turned anything on. Like when I go to yoga, I stop at home. I'm at home for 30 minutes and then I go straight to yoga. And my entire drive to yoga, I'm like, what if I left the oven on? What if like there's a candle burning? And I didn't cook. I didn't light a candle. I was there for 30 minutes, but I just feel like my house is going to burn down.
Mm-hmm.
I'm not diagnosed with OCD. I'm just saying my experience.
Mm-hmm. What about you?
I'm okay. I don't have any of that.
The house burns down.
Hear the fire alarm go off. I got a couple of minutes.
Now, OCD, like obviously it can be called a disease. It can be called a psychiatric problem. But like many other things, the dose make the poison, meaning that so much of that is good. Sometimes so much of that you need. But then when you get at a certain point, then it becomes, it literally prevent you of living your life. Then it becomes a disease. Like water is good for you, right? But too much water, you drown in it. Aspirin is good for you. 7 grams of aspirin will destroy your liver. And not caring about anything will eventually burn your house down. But
caring too much will make you not leave the house.
Not leave the house.
Yes.
So you see, it's always about it's a spectrum of behavioral, and as a human, we are made to react to our environment based on the environmental clues and so on. So sometimes you may have forgotten to turn off the gas heat or the gas oven or something, but if that is a part of your brain that is specifically care about that part, is less likely that you will leave the oven on and so on. Now, but here we are not talking about, like as a matter of fact, they say there are only obsessive compulsive surgeons. You shouldn't be a surgeon if you're not obsessive and compulsive about what you do, because the price of leaving the oven on is very, very high. So in a way, most of surgeons, especially neurosurgeons, they pride themselves. You cannot not be obsessive, compulsive OCD if you're a neurosurgeon. Now, but here that's not what we are talking about. Here we are talking about people that Penny. It has no consequence. As a matter of fact, doing that, it prevents you of having an orderly life. Like, possibly you have to stop, even though you didn't turn the oven on. You stop what you're doing. You have to turn back and just make sure of that.
Mhm.
Now,
I once met a patient who actually had to have the garage door open and close 7 times before she could leave the house.
Wow.
And it would be very difficult for her because she would sometimes have to have her husband go and open the garage door the first time, because if she got the cycle wrong, if she goes over there, the garage door is already closed,
mhm,
then it has to end on closed.
yeah, and that is very typical that I hear. I believe I don't have OCD except at work,
Mhm.
but I hear that they acquire a routine.
Yes.
The routine is what, and if the routine is not hold up, if they don't hold up the routine, it is they have physical, psychological pain and suffering
Mhm.
Yeah, I
that
used
goes
to,
with that.
when I was a server, I had a customer who had OCD. He was actually one of my personal regulars.
Hmm.
And he always, like, if you didn't give him exactly how many napkins he needed at this in a very specific order too, it would almost like he's getting twitches. Like he
Mhm.
becomes very antsy and he's like touching his legs a lot, wiping his hands a lot. I think because he's starting to sweat because he's getting anxious.
Yeah, I have a confession to make. You have not been in many of my ORs, but Dominic, you have been in my ORs. What do you notice when you are in my OR? I'm sure you have been in other ORs and so on. What is there anything specific you notice?
I'd say routine. I am starting to notice that a lot more too, because again, I have been in quite a few other ORs, and each time it's like, okay, we're going to do a thing, and I know what steps are. Is eventually something will happen, or we'll do something else. But when I go into yours, it's very much, oh, here, boom, bop, bop, 1, 2, 3, 4, 5. Like,
Now, if you know, pay attention from now on, you will see certain things are always in the same place. Lines like those wires and so on, they are always in the same order. There's a saying, the amateurs do it until they do it right. Professionals do it until they cannot do it wrong. Then
like
you have a full-blown OCD. Now, what you notice is that, and that what you just described as well, for me, if the lines are not straight, if the clamps are not in the right place, for me is an actual physical pain that I get extremely angry. And some people have been on receiving, this is my confession, some people have been on the receiving end of it. When, like, I'm starting my routine, you may notice that, my behavior changes a lot when I'm in the war. I'm not chatty, I'm not socializing, I don't
You don't play music. Like
I don't play music and so on. If any music, it has to be something classical, slow, and so on. And I don't have to have that. It's just if other people feel uncomfortable. But when I enter the room, I'm a different person, and everything that brings me out of my routine is causing me physical pain and anger. I get extremely, very quickly angry if somebody comes and stop messing up my routine. Okay, but considering that what are at stake there, this is the routine I need to do that specific job. Now, and I have been told that I'm a I'm 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 an a-hole in the OR, and now and you can argue if that really prevent me to build a social surrounding in the war. I would argue I'm not there to make friends in the war. I'm there to do a job. But on the other side, I think that is borderline what you could call a disease.
Yeah, I'm wondering where is the line between OCD and pretty much what you just described, where you're
If
not.
it hurts you instead of helping you, I think that should be the now. What I do is borderline because it definitely helped the patient. There's no way you could do what I do, but everything goes.
Yeah. Woo! Yeah, it
There's
doesn't.
no way.
Mm,
We do a 7-hour surgery in 45 minutes, send the patient home 2 hours later.
mm,
If you're in and out, it is like, it couldn't be more precise surgery. And that
mm,
requires lots of attention. Like I'm like a pilot, fighter
mm,
pilot. Okay,
mm,
they now on the other side, it has hurt me because people think in the war, they think they don't take it that he's focused on the job. You think he's just an a-hole. He doesn't talk. He doesn't
mm,
let us talk. He doesn't let us listen to music and so on and so forth and so on. So it has hurt me already by not building a social structure in the war with the war staff. So
mm,
that's borderline because it has helped the patient but hurt me in the process, not
mm.
building that. So, but I think that it should be the threshold.
If it's
Yeah.
hurting you, or what if it's hurting other people?
Well, it's even worse.
Yeah.
If
Mm.
it's hurting other people, it's even worse. Now, in this scenario, it actually the only way to do the job, this job at least, like you have told me that some other people who do the same procedure need twice as long as I do,
Mm.
but they have less angry staff in the OR because kind of everything goes on.
Let's just wait 8 minutes for that instrument to show up.
Yeah. Okay.
If he's waiting 8 minutes, he's like, I will go get it myself.
Mm,
But so, and if it come, but most of the time OCD doesn't, to my best knowledge, doesn't hurt directly other people. It hurt other people that they have to work around you.
Yes.
Yeah, I think that the situation that Dominic described would be a good way of not hurting other people, but definitely interfering with other people. If I had a partner that said, I need you to go and open and close the garage 7 times, I'm pissed. I'm really not.
Yeah, so you're pissed easily. Come on, let's make a garage.
Seconds for that's
Mhm.
7 minutes.
That's a 15-minute thing right there,
Yeah.
almost.
Yeah.
Now, I will say kind of, I think the metric for a lot of things like that, where it comes to when does it become a problem, is when it's a problem. In fact, I think that's something that's very interesting about medications a lot of the times. Medications, you always think of them having side effects, but small anecdote, Viagra was originally blood pressure medication, and then it just happened to have a very unique side effect.
And then the side effects became the indication.
Exactly. And so, I mean, that's kind of how a lot of stuff goes. You wait until you see, all right, does something else happen with this that I don't like? So when you find the person who has some version of obsessive compulsive, but it just means everything they do is organized, okay. Maybe that's a little stressful for their life because they have to have things organized. But
Now, do you know what profession is that they force you to be organized? You do not have a choice. You have to be
A
OCD.
lot, accountants.
No, I'm talking about a specific job that they force you to be OCD. That you don't have a choice not to be OCD. Pilots. And they enforce it by so-called checklist. Okay? Like 7 time up and down. That 7 time is there. You turn this on, then you turn this on, then you turn the first one off, then you turn, and so on and so. There's a checklist. So you cannot do it wrong because we know what the price of that is.
Yeah.
Now, and if you look at that, behavior of the pilot, and if you take that pilot out of the cockpit and put him in a social milieu and so on, and he does the same thing, he behaves the same way he's behaving in the cockpit, then you would definitely diagnose him with OCD. Okay? And imagine you go to eat and somebody bring out a book and then it says, okay, napkin here, the thing here, writing just exactly what you just described. Okay? Now, and again, sometimes they have a function, like for pilots or for what I do, it has a function.
Yeah.
Literally, people will die in that situation. I don't really care what Scrub Tech or somebody else think of me, because the price of not doing in the right place, I can be in patient's spinal cord or in aorta, have severe consequences, or pilot crash and everybody dies, not to have checked weight and balances and so on. So, but where is the fine line? And that individual is different. Where's the fine line that you say this doesn't have function, or it used to have a function, it doesn't have anymore. Let's eliminate it. Once you get there, you cannot eliminate that. And there is actually a very good study that once it's established, this path, like that 7 time up and down, like did I turn the thing on and on or not? Have you created a routine for that, or is it just your fear?
It's just my thoughts.
But you haven't created a routine
No,
to
because
overcome that.
no.
Then you're not diagnosed yet.
I just keep living my life and just hope. I just
Oh,
like
no.
when I'm thinking my house is burning down, then I tell myself, well, if my house is on fire, my neighbor will text me.
Okay, yeah, you could beat it down with some logic there. You're like,
Yeah.
Exactly. You're something we call subclinical, meaning that you have the fears, you have the anxiety, but you haven't created a routine that literally interfere. Like you don't go halfway to work and then drive back and so on, or you don't go 7 times up and down to make sure it is working. That is what I think 7 times up and down is. That she wants to make sure that it's working, the mechanism is working, and so on and so forth. That there will be no question about that.
Yeah, her brain can't say, "Oh, on 5, we're good."
But if I were in her position, like I'm just saying, if I were opening and closing the garage 7 times, the 7th time I would be thinking to myself, I've overused this garage and it's not going to open the 8th time. That's what I would.
I don't see that's something else.
Wait, I process things.
She had to plan her trips around, and she'd have to leave early, so that way she had enough time on her schedule to open and close the garage.
So she's planning.
And that's what it is. Most of the people with the OCD, if they're clinical, they create routines to overcome the anxiety, and that's what it is.
Yes.
And then that routine interferes with their life.
People that have OCD, if they want to treat it, is exposure therapy something that works for treating OCD? Like,
what do you know about exposure therapy? Because in some areas it has been used very successfully, in some other areas much less.
Yes, actually, I believe OCD is one of those ones where they have proven that if you take, for example, exposure therapy, of that would be, I can't leave my house without rotating the doorknob 3 times. Yeah. So I would have that patient leave the house and not be allowed to do it. Yeah. It is counterproductive for a lot of those OCDs, because instead they have sort of what you have with my house burning down, but they had that feeling of impending doom. They have that client you have who's so anxious, and it just builds and it builds and it forms this pathological response in them where they go, oh, now I know I have to do the doorknob turn.
That's what I was guessing.
No, there are other areas that exposure therapy has been successfully used. Do you know what they are?
There's some phobias.
Phobias, exactly.
Also, I heard that, like, I think it was like Tony Robbins. He had someone who was addicted to chocolate. This person was eating chocolate every day. So then he made that person's life. Like, it was interfering. So he had that person go home and eat too much chocolate. So then they got sick from the chocolate, and supposedly that helps them overcome like their chocolate addiction.
There's some amount of chocolate you can die of, right? We talked about the doses.
It didn't happen.
So in the phobias, the exposure therapy, but you have to build it up. You cannot just throw tarantulas on somebody with arachnophobia. What you do, you just write the name of a spider and put it in front of them and leave them alone in an empty room with them. Just the name of the spider. And then you have a cartoonish draw of a spider. Then you have a more realistic thing, the drawing of the spider. Then you have a picture of a spider. Then you have a dead spider, plastic spider, then a dead spider. Yeah. So we know that works for certain phobias. If it doesn't work obviously for everybody, but I think for OCD, exposure therapy is not as helpful or as prominent as for phobia. Now, you said you have no OCD.
Watch out.
I actually, as we've been thinking about this, it made me realize, so there's a sub in other categories, many categories of OCD. One of them is excoriation disorder. I don't know if anybody's ever noticed. Essentially, like, the height of it is you are over here picking your skin. So if you do this and you get the little red, that's an excoriation. So
No, not that you have it, but that you have to do it.
Oh,
really.
no.
yes,
No.
you are, and oftentimes these people, they're not even necessarily aware of it. They go, okay, I have to scratch, I
Oh,
have
yeah.
to scratch,
To
or
give them calm themselves
Yeah,
down.
yeah.
Mhm. and
And
then
some people do not only that, but some people even insert things in their own body.
yes,
And
yeah,
so on. That is a
Mm.
that is and that is a and not to mistake with some other sexual
Mhm.
problem that
Yes.
people insert things in their orifices and so on. No,
Mm.
this is truly now that the scratching, pushing, pinning,
Mhm.
inserting something sharp.
Yeah, I used to know
to
someone
calm
who
them
would
down.
pluck their eyelashes out.
And they do. I mean, it's like a focusing thing. You promote a stimulus, and so whatever anxiety was previously driving you, you go, oh well, I'm noticing this. Oh, I'm noticing this. I'm acting on something.
That I love to pull my hair. Or,
See?
or somebody else pull my hair. It just calms me down. No, as well, this that sensory stimuli to calm yourself down is nothing unusual. Again,
Mhm.
it's about the dosage. It's
Yes.
how much of that. As a matter of fact, I'm sure you guys have heard of Temple Grandin, right?
Oh, yeah.
I haven't actually.
Temple Grandin is a behavioral psychologist, a professor who had actually severe autism,
Oh.
and he,
She
oh yeah, she was actually, I think, originally
she was
from
living on a
Midwest.
farm,
Yeah,
and
Mm.
she noticed that when the cows were going to slaughter, they had a lot of anxiety, and there was like this machine that hugs
hugging
them.
machine. Yeah,
And she went in the hugging machine, and it really calmed her anxiety.
Mm.
So she invented the hugging machine, right?
so well, the idea is here that she had severe anxiety additional to autism, and she had OCD, very clearly a severe OCD, and then the and she was in a farm, and she was very observant regarding the behavior of the cows, mostly cows.
Mm.
Okay, and she noticed that the way the cows are fed, led to the slaughterhouse, it is very traumatic. The industry didn't really care until she proved by making it more gentle, the quality of meat goes higher so they can make more profit.
Mm.
Long story short, she created a path that is like a circular path that the cows, they are not fed directly to the slaughterhouse. They are fed to a path that gets narrower and narrower. And then at the end, they come to a place that the device that it literally hugs them,
Mhm.
and that they feel they have not stressed. And it's at the point that the bolt, the
Yeah, the air
nitrogen
gun or
driven
whatever.
bolt comes in,
Mhm.
and so until the end, they are stress free and anxiety free.
Mhm.
But the reason her method are widely popular now or adopted is because the quality of the meat and the price of the meat is higher. That's
Capitalism.
the pervert part of it. Um, but again, this she has a lot of research about how to reduce the stress with sensory stimuli,
Mhm.
and so that part of the OCD. Okay, but
Mm.
again, it's about everybody at the end of the day has some sensory stimuli that they use to distress, and you start with babies, right? Pacifier.
Mm. Yes.
And babbling is actually a sensory stimuli. Like some people that I know do this, and they kind of make like little noises to themselves.
That's is that person here in the room? I'm in here.
No, it's you. And actually,
No, yeah.
people make those noises to like recenter themselves in a way mentally.
No, should I make another confession? That is to just give you the feeling that I'm listening to you, but I'm absolutely not listening to you.
You
Hmm.
make those noises.
Is that right?
You didn't know?
No, I didn't know that.
You make noises all the time.
Nobody knows.
Alone. How do you know when I'm totally alone that I'm making that noise?
We got to take the camera out of his bathroom.
You
You won't remember.
make these little noises, and it's a way of like I can't think of the actual word.
I'm never alone. I'm always with somebody, 5 people in my head,
Oh,
and I have a conversation.
The 2 devils on each shoulder.
no.
But it's a way for people to actually like regroup.
Do you talk to yourself? I think that's part
In
of the
my-
OCD as well. No.
Oh, I hate talking to myself. I have nothing interesting to say.
Ooh, I love talking to me.
some of the words Amanda has used. Just because I'm your friend doesn't mean you're my friend. I've been crying all afternoon. My ex called me and told me how much he misses me. It's so hard to miss somebody like me.
Well, actually, this is
That
so,
went viral, by the way.
this is actually a great addition to our depression episode. I never say anything bad about myself in my head or out loud. If I'm saying something bad about myself in my head, I will stop myself and change what I'm saying.
Yeah,
maybe you
not Dominic and I.
Yeah, I don't know how to do that.
I did, and I think what you're doing is a very healthy way,
Thank you.
and as well some behavioral therapy that are focused exactly on what you're doing.
Yeah. Cognitive behavioral therapy takes a really big focus on that.
And not talking to yourself as well is a coping mechanism. It's good. It's good. What I do is wrong.
Do you fucking mean things to yourself?
No, I talk a lot to myself. There's not a moment, and you know what speed I'm listening to my books. The speed of my thoughts are even faster than that. So it's always a conversation back and forth, solving problems. And a day I don't get better in some way, I hate myself. So it's not a healthy way. I'm not saying you should do that, but then I sometimes I write poems, and one of my poems is about that. I met with my brothers, and they're the happy self, and they haven't moved. They were where they were 20 years ago, and they're happy. They're content with their lives. And when I look at them, I see my childhood household and my parents. They are the same. Every time I look at myself, I see a different person. Every month, I'm a different person. And the next person always resent the last person because that was worse than. And if I don't get better, I resent myself for that. So not the healthy way to deal with that, but the engine of. People say, where do you get so much energy? How can you do all of this? And so on and so forth. Now, again, that wouldn't work for everybody. And it's just a different philosophy. My OCD is I have to learn every day. I have to be better. If there's a problem, I have to solve it. If you look at my office, it's chaotic, but there are boxes that I sorting. That actually helped me to relax. Sometimes when now what I have made that my vices and my OCD becomes helpful and useful for myself and somebody else. That is what I can tell you could be a good thing. If you have OCDs, find out how you can channel it to make something good out of it. Should I give you a popular reference of that? There is a show in the TV I used to watch and love called what's his name? He's a serial killer.
You.
No, not that one. Not me.
No. Dexter.
Dexter.
Dexter and you are very.
Yeah. Dexter is a
show you. Okay, understood.
I don't remember his name.
Yeah, Dexter. He's a serial killer with OCD, but his father or the adoptive father helped him for him to create a routine. He only kills serial killers. But he has a routine, he has an OCD, he has to prove, he has to have actual, like a judge and a jury. He has to prove these are evil people. They have killed people, they deserve to die. And then he goes and kills them with a ritual to calm himself down. He's a killer.
Yeah, there's people like that in real life who kill only, like, they kill bad, like people that they consider to be bad
They
people.
consider to be bad. No, but that's extreme. That's a TV show. But some days where I really need to cool myself down and calm myself down, I go to our shop and I sort screws.
And some,
That helped me to calm down.
but there is ways that kind of thing like can interfere with other people negatively. Like remember when we were in California and we had to go to the airport and we were kind of running late already, and then you found this clump of wire that you just had to organize it. He needed help to organize it because someone had to hold something. So, no, we're not done. Someone had to hold something, so I couldn't get anything ready because I had to help him. So, even though it seems super harmless, OCD can really actually impact other people. And then, what if I have OCD about being late? Now I'm feeling worse.
No, you see that there? I'm telling you, I'm borderline. Well, in that, the harm is probably wasn't. We didn't miss anything.
No, we didn't miss anything. No.
And so on. So the harm is limited or non-existent.
Limited. If we would have missed that flight,
The harm would have been.
The harm is with us right
now. There is another thing with OCD or any kind of problem that one of my teachers used to say, you can do all mistakes as long as you go and correct it yourself.
I was thinking that.
Meaning that if we would miss the flight, probably I would have paid for that, rebooking the flight. And
money-wise, you would have paid for the flight, yes. Emotionally, it has been paying for it, to be honest. But you're right. Like if you were talking about the OR and how you're really not making friends in the OR because you're not there too, and you have your OCD there. But it doesn't mean that everyone has to think you're a bad person, because outside of the OR, you can be nice.
I can be nice, yeah.
So I think, like, yes, if you make a mistake, but you can always go and fix it. So if you're OCD,
did you hear about the dessert I made for?
You know, I gotta say it now. You always talk about how you're such a meanie in the OR. You're always like, hey, I'm sorry, I'm a different person in there. Have you met many other people in the OR? You're not that bad, man. You're not that bad.
I think what's special about me, truly, I'm a different person.
Mm-hmm.
My personality is truly different there. I don't even register your jokes. Like Alyssa is always trying to make a new joke in there and so on.
New joke drop.
No, as soon as Alyssa opened the mouth and I notice it's not related to the patient, it's already blocked. Like
Yeah.
or Amanda is. And some people, Amanda knows, and some people do respect that properly. But again, I'm telling you, it's a borderline thing because you assume everybody's professional. Many people, even though they should be professional, they're not professional. They don't respect that place is a place for us to do a high-level job. They take it personally, and then they go and complain that, oh, Abbasi doesn't say hello to us. He doesn't appreciate us and so on. Well, sometimes when I go in a room, I say everybody, the first time I did it in Kansas, we are going to, this is a very technical procedure. This is what we are going to do. Thank you for what you are going to do. I really appreciate that. But when we are doing this, I'm not going to tell after everything, thank you, and so on, because my eyes are just here and so on. No. You expect like the pilot and co-pilot, the pilot and the tower say, take a airway, this and this, land at this speed, and no thank you, no please, and so on. You would think professional people would understand that. They don't. And that turnaround can come back and hurt you. So you have to dose it to a certain point so you don't set up yourself with lots of people who would love to see you fail.
Well, I think
because people are people.
Yeah, but a lot of people, once they get to know you, they understand that you're not trying to be mean.
Oh, what he just said.
He just no. Dang, she didn't even get dessert afterwards. What the heck? Oh, okay.
Now, we were talking about OCD, obsessive compulsive disorder. It is the spectrum of that, like any other disease. Is nothing is yes or no, and we talked about that if you have anxiety but you don't act on it, you're subclinical, like Amanda, who's afraid of the house burning, but doesn't really act on it and doesn't go crazy. It can be borderline, like in my case, that it actually helps the patient, but it does hurt me in some ways because word is not a perfect place and not everybody's professional. But it can as well be a disease where it actually, like you said, if your partner would ask you to do that, that would be a very short relationship.
Yeah.
So
We wouldn't be
meaning
married.
that would hurt that person, but it can as well go to much farther, where you described that the excoriation disease that were sometimes people they literally they injure themselves severely, but that calms them down. Now, there's medication and non-medicative ways of treating that. What do you know about what can we do for that? If somebody has a severe form, obviously milder form, we shouldn't consider, medication and so on. But uh, what do you know about the treatment for OCD?
So medication wise, actually very little other than some of those atypical psychotic agents or whatnot. But for some of the less severe modalities, some people who, for example, if you have the form of excoriation disorder where it's a hand washing thing, you have to scrub your hands, you're scrubbing them raw. A lot of times, certain ones of these get heightened in periods of anxiety. So it's controlling the other elements of your life. The woman who garage door up and down, up and down, up and down, she does that a lot more often when she starts a new job. She does that a lot less often when she's, on vacation.
So you were talking about there are some atypical antipsychotic medication that can have effect, but mostly we are treating the symptom, which is the anxiety. And hence, the anxiety medication is very typical.
Benzos and stuff.
Benzo could be given. Benzo are called falling out of favor because they have a lot of side effects. What are
like duloxetine or something like that?
Yeah.
We can work. Just a very typical. So OCD presents very flashy. Very, very flashy. You see the person who has to do the thing with the garage, and you go, okay, that's a problem. That same person could take a class of medication, and she does, that somebody who just gets anxious throughout the day to day would take, because they're both treating anxiety.
Now, anxiety, let's put it this way, there are two kinds of medication: sedative anti-anxiety medication, which is benzos, Ativan. Sleeping pills do the same thing. They sedate you generally, but there is the non-sedative anxiety medication like duloxetine, Visceral, and some other medication that they can reduce the anxiety without sedating you. Okay. Now, but more or less, the anxiety is a big part, and it affect lots of different things. Like we give for pain, we give after our surgery, we give patient, even if patient who don't have anxiety, we give them Visceral, we give them anxiety medication because it seems that there are lots of paths in our brain are connected. They get connected, and if we practically calm down one area, it has bigger effect on the overall performance of the patient.
And it doesn't have to even be acute anxiety that you recognize. For example, the woman who garage door, or the person a doorknob, or the hand washing, they recognize, all right, that's anxiety. You might not really notice that when you're admitted to the ICU or something like that. That anxiety is a big part of your issue. A lot of the times, those patients will get Visceral. They'll get an anti-anxiety medication after a horrible car accident, their broken ribs, hooked up to all these sorts of machines. It probably doesn't first thought, okay, this patient needs anxiety meds.
Well, another thing that we need to talk, not that we are talking about anxiety, which is a major symptom of OCD, you should not take it lightly. What happens when, I'm sure you have had anxieties. What do you notice on yourself when you have anxiety?
My face is hot because more blood. I'm sweaty, maybe shaking a little bit. Sometimes maybe my vision's a little bit more blurry depending on how anxious I am. My heart rate is high, and sometimes I'm kind of nauseous.
Good description.
Thank you. A lot of times I also have to like use the restroom.
Mhm.
I can't think clearly. Sometimes I get kind of tunnel vision when I
Is
have
it
really bad anxiety.
High heart rate,
Mm.
blood pressure goes high. Your vessels open up on your thing. That's where the flashes, sweating, and so on comes in. You can cool down faster. Your high rate of the heart rate makes you more prone to have heart attacks. If you are a young person like yourself, doesn't matter. But if now imagine you're a 70-year-old person who has cardiac ejection problem and so on, and that's
30% or something.
your heart rate goes to 130, 150.
Mm.
So it would not be unusual to have a heart attack in an anxiety episode. Like, um, have you heard of you scare somebody and all of a sudden the heart stop beating?
Yeah.
Everybody has heard about that. That's not. That's not only in movies and so on. That really happens.
Mm.
Okay, so the symptoms of the OCD, which is the anxiety, can be very severe if certain circumstances, certain things come together, like you have an additional heart problem, additional, cardiopulmonary vascular problem, and so on. So we should not, coming back to that, we should not try to just over confront them with that, with the hope that they get over it, that come back exactly for that reason. Okay. Okay.
So treatments for OCD, sometimes medication, therapy.
Definitely therapy.
Therapy
What
first.
would therapy look like? Like, would it be?
That would be a good question. We should bring actually a psychiatric or psychologist to talk about that. But I think behavioral therapy is like with you, is going to core of the problem. What is it about? Why do you have this anxiety?
Yeah.
And so on. And what routine can you establish that can it be dealt with in a rational way? Okay, or is it? And that is another thing that separates the disease from not disease. A disease can be dealt with rationally, like with it. If it's if subclinical in your case, you can put a camera in and see if you are thinking, oh, okay, it is, or have a video camera in your garage. Oh, it is closed. But if it becomes truly the clinically relevant part of the OCD, that camera or that sensor wouldn't really remove your anxiety. Now, they are generally very hard, to my best knowledge. Once they're established, they're hard to deal with.
Yeah.
But there are certain behavioral modification you can do. Certainly, symptomatically, the anxiety symptom can be dealt with as well with medication, but definitely should not be the first line of treatment.
It's very tough for what I remember when I had some time with psychiatrists. When it comes to a lot of these OCDs, it's such a case by case deal. You don't treat the woman who does the garage door the same as the man with the door handle, because the man with the door handle might be different from the other guy with the man with the door handle, because one of them is the front door, the other one is the back door. They're completely different things, and a lot of the times sometimes there's an inciting event. Sometimes they go, oh, I had a burglary happen 7 years ago, and ever since then I always have to lock it 7 times before I can leave the house. Sometimes they just go, I woke up on a Tuesday and now I have to flick the lights on 7 times before I leave the room. It just depends. They're all so different.
Yeah. So I think that almost invites psychologists to our podcast who can talk more in depth about the actual behavioral. We should talk about the behavioral modification and behavioral therapy for OCD.
Thank you guys for watching. That was Essence of Medicine. Today we talked about mental health and we focused on OCD. I'm Amanda Armagost.
Dominic Moore.
And I'm Dr. Abbasi for Essence.